All right, good deal. We're recording. We're good to go.
Cool, man. Cool. So you just wanted to cover just kind of the nuts and bolts of Medicare on this, right? Is that the goal
Yeah,
here?
and then like some of the guys have asked what do they call what is comp paid out at? What do you make for per different type of policy and shit? It like if any type of override is available, what is it? And just shit like that. What do we have set up so people know where to go to quote carriers and find information about what people can get for prescriptions, etc. Just basic stuff like that.
So moving forward, guys, we won't do these trainings unless you're fully certified and contracted, just so you guys know. I'm doing this out of courtesy for Mike, but we don't normally do any training for anybody unless they've done the prerequisite required things to be able to do Medicare. Includes the AHIP. So we'll kind of go from top down, if you will, just to give you guys an idea. So obviously, I don't know what everybody's experience is here on Medicare. Some of you might have some experience, some of you might not. So I'll start from complete scratch from beginning. So
Everybody here is in the course, I believe, right now, and I think
I'm
Schultz.
taking my test here in a couple days, so I'll be done. I'll be licensed
Wait,
here
can you get me the course?
soon, and then move on to the AHIP. I think it is. Who, me or
I'll send it to
Waylon?
you, Joe.
Oh, okay.
Good deal.
cool. So
I have all my stuff is all done.
sweet.
All right, let's
Uh,
go ahead and get to it.
First things first, obviously getting certified. Before you can even do that, obviously you need a health insurance license. That's first things first. You can't do Medicare without a health insurance license. So anybody that watches this, listens to this, anything like that, obviously you have to get your health license. Once you have your health license, then you have to be certified. So to do Medicare Advantage or prescription drug plans, you have to take what's called the AHIP. That's a once a year test. It's an open book, open note test taken from home. It's usually $175 to enroll and take. We give you a discount code to make it 125. Once you've passed that and gotten your certification for that, you'll need to do contracting. There's a link for that. It's just a data gather form where we get all the data that we need to send out contracting links for you and direct you to you. You'll get all the carriers that you need: Humana, United Healthcare, Aetna, Anthem, Cigna, Devoted, Molina. And then if you're in certain states like California or Pennsylvania or Florida, there's some other carriers as well that you'll get access to, that are regional carriers. So our team will get you contracted, to get the link sent out to you so you can get up and going. Once you've gotten contracted with the carriers, you'll need to do what's called carrier certifications. Those are free of charge. They're not going to charge you to take those, but they are required. So once you complete those, you are what's called ready to sell, or RTS. You'll hear both of those things thrown around. You have to be RTS and have that completed to be able to market, sell, and solicit the products with that carrier. Uh, that's kind of the primary frontline things that has to be done. Can be done pretty quickly. It's not that strenuous. It's a couple of days of contracting paperwork and taking little exams and tests and things, but it's not that bad. But once that's all completed, you'll start getting access to the tools that we have. Our kind of quoting enrollment platform software is called Sunfire. So you'll get access to that once you're RTS, not before. You don't get a login. You'll be emailed a login directly of the link to the platform, as well as your login. So Sunfire, and Mike, I'm going to do a separate training altogether. I'll talk about it today, but we'll do a separate training for your group specifically once everybody's RTS and has some cases to run through it.
That's
But
fine.
but Sunfire is an all-in-one platform. So it's basically, if any of you have used insurance toolkits, it's that, but even a step further. So you'll do all of your quoting, all checking medications, all checking doctors, hospitals, networks, and you're enrolling all on Sunfire. So you don't have to leave that platform to do anything. So you can write Humana, you can write UHC, you can write Aetna, you can write Cigna, all in one platform. It doesn't take you to external links. It doesn't take you to other pages to have to sign in. No, it's one place. You'll do your scope of appointments in there. You'll do your enrollments. It'll save all your data. It's an awesome platform. We spend, just transparently, we spend 100 grand a year and $15 in enrollment for it, for everybody to get it, because it makes life that much easier. But instead of having to plug in Lisinopril 17 times in 17 carrier portals, you can do it once, and it'll tell you which carrier you should be using. So it does your quoting, you do your enrolling, all in one place. Again, you have to be ready to sell have your certifications completed to get access to this. Okay, so that's Sunfire. That's a primary tool. That's for Medicare Advantage prescription drug. Medicare supplements, there's no certification process. It's just contracting. The majority of what we do is Advantage, but we do obviously offer supplements as well. We have all the carriers needed for that. We're again not going to go into full detail there, but the contracting for that is very similar to like the life insurance side, but for health. You just have to get contracted. The commissions are percentage based, like the life side. There's premiums attached to the plans for the most part. And it's pretty straightforward on the sub side. So we have all the carriers you could ever need there. Street levels anywhere from 18 to 20%. There's override levels. The very, very top level is 25 or 26%. You have to be doing 5 to 10 million a year with that carrier to get that level. I'm just being honest. That's about what it takes, which sounds like a lot, but med sup premiums are 18 to 2,500 per year each app. So it's not as much as it sounds. So, we have all those levels available and you're able to move up based off your production and that type of thing. So, with that being said,
here that like, Medicare is not a get rich override scheme. You've got a right to actually get anywhere with it. You're not going to get rich off Medicare overrides at all.
no, you can. I mean, I am, but we wrote 45,000 and I mean, Humana sent me $4 million for marketing last year. That wasn't override. That wasn't agent commissions. That was marketing. That's it. That's because I spent 4 million of my own money last year to write the business. So the best thing about Medicare, and I'll tell all of you, is it stabilizes your entire business. Final expense, we've all been there. I don't give a fuck how good any of you guys are or how good you think you are. You've all had debt. Every single fucking one of you from final expense.
Yeah, for sure.
You know how much debt I paid in Medicare? $0.
So how much last year in final expense roll up?
I paid 120 grand last week. Well, it was 1.4 million in roll up last year. We did about $81 million in premium, but I paid about a little over $1 million in debt from a downline agency. But guess what? It didn't matter because I got Medicare. So that Medicare is way better because all of our final expense business now is off of Medicare. Every single final expense app we write at this point at an agency level is from a Medicare lead. It's the best final expense lead. They're all over 65, so they're all old as shit. They're all low income, so they're final expense people. So they've probably been seen by some dipshit agent that wrote them America, so I can replace it. It's fucking great.
He's not lying. You
got an America Eagle from 2018? Great. Well, I've got Baltimore Life from 2023, and it's still less money. I'm gonna get your money back.
Strong.
So, but that's way down the path. So, the biggest thing here, guys, as far as payment goes, is from an agent level. You can tell anybody this with a straight face, and you're not fucking lying. That's the difference. Life insurance, to recruit, you got to be a kind of a dick, and you got to kind of lie to get them to actually do it until they do it. Once they do it, they're like, wait a minute, I thought I was in a 120. Well, you are with 2 carriers and 2 products. But Medicare's not like that. It's all standardized. So you can tell literally anybody on the street, anywhere, fucking anywhere. If you get to 330 clients in your book of business, paying $0 a month, you'll have a 6-figure residual income. You'll get $8,333 deposited into your bank account every single month until all your clients are dead or you're dead, or both.
Wow.
How much was that figure again?
330 clients.
Yep.
660 is 200,000. 990 is 300,000. And guess what they pay total? $0 a month.
Insane. Just run around racking up apps.
So, but that's why we made the transition that we made. We still sell a shit ton of FE, but now we've taught people how to cross sell it on the back end. It's a hell of a lot easier to get somebody to go grab a policy once you've already taken all their meds, you know their income, you've helped them apply for Medicaid, you may have put $200 a month back in their pocket, and now you're their Medicare agent, than it is to go in there and say, hey, Miss Jones, go grab that for me. You don't know shit about them. They don't, I mean, unless they're super nice, they're not going to do it, or you're a good presenter. With Medicare, you just do the Medicare portion first, then transition into the final expense.
And you already have all their medications and health info.
Have all their meds, all their doctors. You already know who they qualify for if you're any good at underwriting. They've got lisinopril, metoprolol, and metformin. It's anybody you want. But if they've got nitro, one leg, and an eye patch, you're like, fuck, we're going Sika. So It just, you obviously that takes time to learn in presentations, but the hard part's out the way if you do Medicare first. The hard part is done. And the final expense that you get off of it is higher quality business because you're not talking them into $47 a month. You're usually either A, replacing what they already have, or B, you're utilizing the funds you just put back in their pocket from the Medicare. Hey, we just saved you $145 a month. What do you got for your burial? Or hey, if they're on Medicaid, did you know if you have over $2,000 of cash value, you could lose your Medicaid? Okay, great. You got any life insurance or burial policies? Go grab that. I want to make sure you're not in jeopardy of losing your Medicaid benefits.
That's strong.
Million ways to skin a cat, but that's how we pretty much do everything. Now, the other part to this that's huge for an agent is the leads. Medicare leads are much less expensive. Direct mail leads are basically $34 per lead across the entire country. So that's fresh, exclusive direct mail. Out of 20 direct mail Medicare leads, you should write at least 8 to 12 Medicare Advantage apps. You'll set on 15 of the 20. It's not like final expense. Even if you're a really good agent on 20 FE leads on a good pack, you're setting 12, 15, 12 maybe, and door knocking 8. If you're lucky, you're setting 12. Not Medicare. They want to talk to you. They want help. You call them, you set the appointment, you go see them, you conduct the Medicare app, you go over their local, state, and federal benefits. We have a whole pitch around it and show you guys how to do it. And it's very duplicatable. That's the biggest thing. And it brings lead costs down. You're not paying $79 for a final expense lead through MailPro.
Sure.
$34 per lead, any county. And we can even do by zip code. Like if you're in bigger counties, like I know Mike's in, like Detroit metro area is pretty huge, the county, at least the counties. So we can do like 5, 10, 8 zip codes.
So wait, real quick, this might be a stupid question.
Not at
but
all, man.
Are you typically door knocking these, or are you selling these over the phone?
Yep.
I
So
was just gonna ask that.
Yep, we have face-to-face and phone sales. We do both. So with phone sales, there's more compliance though. I will say that, and there's less opportunity to cross-sell. Well, I mean, you guys all know it's easier to cross-sell face-to-face than it is over the phone. Not saying one or the other is better. You can write more apps over the phone, but you're writing, more Medicare apps. You're not necessarily going to be cross-selling additional products or policies.
Gotcha.
So again, they both work. We have models for both face-to-face and phones.
Yeah, I just say that because like for me and Brian, like we're on the phone with our other businesses and stuff as well. So that would probably be more our avenue at least.
Absolutely. So what we do there is it's just inbounds. So you're taking inbound live transfers on that.
Cool.
And that's all. What's that?
You guys have a promote. You guys said it's like a promotion. It's like something you guys do for your IP. Like if you write like X amount of apps per like week or something like that, you get X amount of direct mail for free or something.
Yeah. So 20 apps a month is 20 leads a week for free.
That's 20 apps a month. That's every agent should be able to attain that.
Quick question.
Yeah.
So just for that incentive right there, like let's just say, because I'm gonna be with well, not be with Brian and Jois, but I do all my business over the phone as well. Would you be able to do 20 free live transfers, or is that a completely different? You just have to get the direct mail if you do the 20.
It'd probably be 8 or 10 free live transfers, not 20, because
Perfect.
Yeah, so it wouldn't be as many.
Awesome.
We can mirror
Okay.
that.
What's the typical price for
I
a
just
mailer?
don't plan on ever door knocking, so that's why I just figured.
Yeah, you're good.
So can you, besides the direct mail, Waylon, can you guys let them know like what do you have available for Medicare leads so that like obviously it's not just direct mail, what's available and out there?
Yeah, so we have the direct mail. We have digital leads as well. They're real time that work pretty well. They're $16. And then for the live transfers, it's a monthly seat fee. So you pay a monthly charge. It's Monday through Friday. You don't necessarily have to be on, but that's your call. If you're not on, you're not on. It isn't like you get your money back. So the call center operates Monday through Friday. You should get 8 to 12 calls a day minimum. I mean, we have people today. So a young lady named Chelsea in our group, she's written 5 so far today.
Can you turn those on and turn them off as far as the distro of leads? Like if I am doing something else for my other business and I cannot accept calls at that time, I don't want just calls floating in that I can't accept.
Yep. So everyone's on we use VT dial for our call center platform. You would just mark yourself as paused or unavailable.
Okay.
How much does that cost for the month on that?
So right now, total, and this is not counting any kind of co-ops or any kind of like if you hit certain numbers, you get a discount or anything. This is just first month bare bones. Our cost right now is $4,500 a month, and again, that pays for everything: the leads, the transfers, all that. So it comes out to like $31 per transfer if you're hitting the numbers that you're supposed to hit.
And what do you if you hit 30? So if you write, let's say 30 apps, what do you make off of 30 apps?
Yep. So that's the thing with Medicare as well, specifically, with Advantage. The later in the year you write it, because it does advance, but every month later that you write the application, there's a little bit less advance. Right now, it's pretty good because it's basically $25.50 per month per person is the renewal. But every month later that you write it, it's 25.50 times how many months into the year you are less. Okay. So if you would have wrote it, in December, like in January, it would have been the 306 minus 25.50. So 280.50 per app for February effectives. For March effectives, it was 255. So for April effective, it's 229.50. So if you write 30 apps, that's $7,000. And that's if you don't get any new to Medicare. So new to Medicare is double commission. So it's 611 and it's upfront advance, and you get the residual kicks in the following year. So there's some nuances to it, but at minimum 7,500 to 8,500. So at least a 2x. But again, keep in mind that's your residual now annually as well. So
that amount will not compound, but you get the residual every year from the
Correct.
Advantage, correct?
correct.
Okay.
Yep.
Now, can you hit on is it even possible to get a chargeback on that advance, or is it?
Yes.
Okay. So how would that happen?
If they disenroll within 90 days, it's called a rapid.
Okay. So after 90 days, though, they're locked in for the year,
Yep.
or
if they're locked into the commissions that you were paid, and you're good to go.
okay, gotcha. Okay.
Hey, I had heard of something. You guys are working on something. You guys are going to start running TV ads and stuff.
Yep. I mean, a little bit, but like the live transfers we do now are working too well. Like they're all off of fresh direct mail and territories that we have agents that didn't buy the leads, and they're working great.
Okay.
So you get it if it's they're new to Medicare, you get an advance, and then if you're just re-signing them up, it's just a monthly renewal, correct?
Correct.
What's
And
the
then for the
advance pay?
supplemental, that's just strict, or that's not strict, but that's just strictly 25 a pop per person that you sign up.
Yeah, no, there is an advance on all of them. The numbers I just ran were based off of replacements, or they already had a plan. You're still
Okay, gotcha.
So
I'm sorry.
first year commission is
Gotcha.
611, residual commission is 306. And that's also the same commission if you replace someone. That's total for the year. But again, the later in the year that you write it, it's that 25.50 per month
Gotcha.
later. So it's prorated, basically.
Gotcha.
That's why, especially for a new person, if you're bringing people on or whatever, it does make sense a lot of times to go in the field and start doing it that way, because you have a much greater opportunity of cross-selling. And as
So now with the supplemental, let's just say I signed Jacob up with the supplemental. He pays $0. No one's charged anything. Is there an advance on that, or do you just get 25 a month per person that you sign up?
So first of all, you'll never sell a supplemental that's $0. Supplemental average is about $140 a month.
Okay. I'm sorry. Then I got confused. Supplemental and like the Obamacare stuff, the Social Security or Medicaid.
Completely separate.
Gotcha. Okay. Gotcha.
So then with the Advantage programs, is there an override on Advantage?
Yep, there's 4 override levels. It's GA, MGA, SGA, FMO. They're $50 increments. So it's 50, 100, 150, 200. The second year or the residual override is half of that number. So it's 50, 25, 150, 150, 75, 200, 100. They're just based off of agent count and application count.
And that's per year. So it'd be like $50 a year and then 25 the next year.
Yep, correct.
When you get paid in advance, how long does it take to get paid?
So any policy I would write any time now would be effective the first of the next month. So you're paid about that end of that first week of the following month.
And then every carrier, it doesn't matter what carrier you do it with, it's all pretty standard pay schedule too.
Correct. It's all the same. Yep.
Gotcha. Perfect. Cool. Awesome. That makes everything way easier.
All right, that's solid. I asked something else and I totally forgot what the hell it was.
Oh, so you said there's the 4 levels for the override structure. What how do you, is it just based on production, how you get promoted there, or
Exactly. Production by carrier. And it's not like things we made up. The carriers actually have levels, and that's just how it works. It's nice and simple.
so if I'm starting at the same time as my agents, am I not going to get overrides until I hit that next level?
Correct. Just because we're not building an MLM agency where everybody that comes in that knows the mailman can get an override, especially if you can't answer questions. Like if an agent can't call you and you can't tell them how to maneuver a platform or answer, a leads question or whatever, it's just an earned thing with us. We want you to build. If you want to build, like, we'll help you do it. We do it every day. I've got 14 agency owners that netted $1 million doing Medicare last year. So we'll do it happily, but we've got to see that you are willing to learn it first. Just because, look, man, I'm one guy. You know what I mean? I get calls and texts about everything but people's fucking babysitters all day long. So I can't also, text with a downline of a downline of a downline about, I need this carrier. It's like, I'm sure you do, but where's your 13 layers of uplines? Where are they at? So, absolutely though. If that's the goal, then do absolutely. I just kind of show that that's the plan. And once you hit those metrics, then you're off and running.
Okay, and you said, I'm sorry, it was $34 for a like door knocking mailer Medicare lead, correct?
Yes, sir. Correct. I'll show if you can share, well, never
Yeah.
mind. Okay, cool.
And then the sweet spot's kind of like 20 a week would be enough to work 5 days.
Yeah, I mean, potentially it just depends on the agent. You know what I mean? Like some people might need more, which, it just depends. You know what I mean? It also depends on your goal. You know what I'm saying? So like, depending upon like, if somebody wants to write, 40 a month or whatever it is, we can obviously give accurate numbers based off of that. So just from our experience, but this is what the CRM that you guys will all get access to will look like. This is where the leads will go into. This is an example of a lead. It's nothing too wild or crazy.
It's a regular mailer.
Yep. Nothing too complex. Here's another version that we have. They better fucking sold this. He's 65, has Medicare and Medicaid. You already knew before you went in the house. That's the easiest sale they ever made. Probably an FE sale too.
Judging from the handwriting, for sure.
Yeah. Well, that and this person checked that I have Medicaid, I have Medicare. It was a dual plan. So she isn't paying the Part B premium, probably makes about $900 a month, probably has an $84 a monthly inheritance policy.
That sounds accurate.
So you guys will get access to that for the direct mail side. And then like I said, the call center platform is very simple. It's streamlined as well. Because the cool thing about that, guys, is like the marketing side, I own all of it. So it's not third party stuff. This is all ours. So like if anything sucks or you guys are like, that blows, tell me. Like you're not gonna hurt my feelings. Just say, hey, this sucks. Like these leads blow. The direct mail, if you tell me that, I'll tell you suck, because direct mail doesn't suck. You just got to figure out how to work them. But on the live transfer stuff, there's some like days where it's awesome, and there's some days where they're terrible. And it's usually just the call center that I own. Like there's some days that they feel good and want to call people and they're doing great. And there's some days where they just must be on a bender or something. I don't know what the deal is, but like there's ebbs and flows of that stuff. So we're not above reprieve or you guys telling us something's going good or something is not going well. So
is your call center overseas or is it in US?
they have 2 overseas and 1 here.
Okay. All right. So when you get a live transfer, what do you get from the agent? Do you like obviously like name, address, date of birth, anything like what else do you get when you get a live transfer?
Um, so it's off of a direct mail lead, so you get a copy of the mailer. Then you get all the data that they retrieve. So you get confirmation they have Parts A and Part B, which is required to be able to do the enrollment. You have a verbal authorization that they are looking to change their plan before they even transfer it to you. So you get the full recording as well.
Okay. All right. Is it like double verified? Like you get one person who calls and then like they do the initial screen and then they pass it to like a screener basically to actually true like prove intent? Or is it whoever gets the call, they screen it and then they send it?
Goes to the agent. Yeah, you can't do double verify with Medicare unless you want to go to
Okay.
prison.
Okay. All right.
That's the other thing too here, guys. It's a federal program. Medicare is a federal program. The federal government runs the entire thing. So essentially all the money that comes from this is from the Fed. Every dime. It isn't from a carrier. It's commissions from the federal government for us to manage these clients, which is good and bad. Because the good news is if the program ever runs out of money, they'll just print more.
It's true. It's true.
Sucks, but it's true.
What is with Medicare compliance over the phone? I know it's like you have to record the call, correct?
Yep, and there's two disclosures. There's a disclosure you have to read, and then the scope of appointment has to be done as well. So we have all that in scripting that everybody will get access to. We have recordings of completed sales for training as well. We'll give you guys all access to all that stuff. I just, again, rather than dumping all this stuff and saying, hey, here's all this, like, just do the certification shit first because it sucks. I'm just being like, it's not fun. Contracting sucks. Paperwork sucks. Tests suck. It all sucks.
AHIP is terrible. The
AHIP
AHIP is
sucks.
terrible.
I'm not gonna sit there and tell
Terrible.
you guys it's great, it's so much fun. It's fucking sucks. But after the first year of doing it, I can tell you it's a lot easier to spend $125 and take a 3-hour test to get your residuals. Because guess what? If you don't do it after the first year, you don't get paid. That first year sucks though, because you're like, damn, I gotta spend money and take a stupid ass test. Yeah, you do. Sucks, I know. But again, once you have a $4, $5, $6, $7,000 a month residual relying on it, it's not that hard all of a sudden. So, and then the other thing too is, again, I know a lot of you guys are coming from the life side. The best part about Medicare, and again, why we chose to build on that side, is just how many fucking clients there are. I'm from Columbus, Ohio. I don't know if anybody's familiar with that. I know a lot of you guys are Michigan guys, so you probably have a decent idea of just Ohio in general. Franklin County is pretty big. It's not that big, but it's a decent sized county. There's 204,000 people on Medicare in Franklin fucking County. Not Ohio, Columbus. That's it. In Wayne County, it was like 147,000. Oakland County, it's like 200 some thousand. So take 200,000 times 306. That's how much money every single year is in that county for Medicare. It's not you and Jimmy that keep knocking on the same fucking doors because you get the same 13-cent direct mail lead final expense. Like, it's not the same thing. That's the beauty of it. Like, we were having the same problems as all the other agencies were. It was like, man, like, I'd love to keep building this territory, but we can't. I don't want to have all my guys calling the same 13 people. Medicare, you don't really have that problem. It's just such a it's a bigger market share. And it gives you, again, a lot of opportunities with people that aren't filling out final expense mailers or aren't filling out, life insurance marketing. You're in the door now. You can ask about it because you're the Medicare guy.
What is the stipulation? So like I know like there's like you can't, and I don't remember. I haven't taken the AHIP in a minute. What is the stipulation for cross selling? Because I know there's stipulations if it's over the phone. I believe in home is a little different, correct?
Yep, correct. So over the phone, you have to set up another appointment to even talk about it. Face to face, what we typically do, I joke about it. I'll do the whole entire Medicare presentation, complete the appointment. Say, Miss Jones, do you have any questions about your Medicare plan? If you need anything, call me. Don't call the carrier, call me. Now, and again, this goes more into the presentation training, which is we're 74 steps ahead when half of you don't even have your fucking test yet. But you basically tell them, hey, we talked about those state and local benefits, but I can't really talk to you about those because that form we filled out, the scope of appointment, the government requires that, this is a separate appointment. Now, do you agree this is a separate appointment, or you may walk outside and come back in? And people are like, what do you mean? Shut up. What is it? I'm like, okay. So local and state benefits, things like your burial, final expenses, like we talked about. What do you got in place for that? Don't know, blah, blah, blah. Well, what we're trying to ensure here is that if they have Medicaid, you ask this question, trying to ensure you don't lose those Medicaid benefits, putting $174 back into your check every month, getting you this dual plan with the extra benefits we talked about earlier. If they're not on Medicaid, hopefully you built good rapport with them. Obviously you did. You wrote an app already. You've already got business in there. So you just, hey, what do you got? Because I'm going to see, if I can get you any discounts, see if I can save you a couple bucks. And then boom, you're done.
It's beautiful.
So yeah, that's I mean, again, that was the very quick version, guys. We'll do a lot of training on this. I don't want to bombard you with a bunch of random ass information. I mean, you don't know which way's up. And that's not
This is perfect for right now too. I can, rewatch this and send it to my agents and stuff and,
Yeah.
really study what you said.
I mean,
So
That's exactly what I
founder-
wanted out of this call was to be like cover leads, like commission structure, if there is possibility for overrides, what compliance was, and just the general basics of that. That way, like people who are looking at it, they know what the deal is, and they're not like they see it coming from us, and it answers all the stupid questions. That way, I'm not stuck dealing with them, or nobody else is either. So
Yep. And then, I mean, we have pretty cool reporting. I'm going to go to the heat map just so, I don't want to show anybody's book of business, but as a manager, instead of like final expense where you're always chasing reports, you'll have access to all your team submitted production by carrier, by state, by agent, their persistency, everything. We've written 326,000 apps so far. So, I mean, we're doing all right. Mostly Humana, which is great news.
well, I said Humana's like the #1 powerhouse out there right now. Like the majority we were actually
That's great news because Humana will play ball. And here's the thing. So here's something else you can tell your agents. Like, when's the last time you had a life carrier call you and say, "Hey man, thanks for the business. We're sending you $2,000." Have you ever had that happen? Just on a random Tuesday in the 18th of the month. Well, Humana will do that. You write 15 apps with them in a month, they'll call you. Be like, "Yo, thanks for the business. We appreciate it. We're going to send you $2,000. Keep going. Pat on the back. Good job." That happens all the time. Happens every day. So you'll have really good reporting as well. This is every single client we've ever written. Well, this year anyways. And we can filter it by carrier.
Are you showing a screen, bro? Because all I can see is the background.
I am sharing a screen, but let's try this again.
You might have displayed a different screen.
You're good. How about now? See it now?
Yes, we do.
Cool. So heat map. And again, we can go every single one of your agents' production, their persistency, which carriers they're submitting, all that. You guys will always have access to that type of reporting for all your teams and everything to make sure it's on top of it. So
Like majority all green, which is all Humana.
yeah, so 254,000 Humanas and 164,000 UHCs.
Scroll in on the top of Northern Michigan again.
Yep.
Bro, I'm about to literally go back in the field because that area right to the left of where you just had your mouse like parallel to the mid like that, like right up where the interstate is, that whole portion from like the right side of the interstate right there. That is the best area I have ever written premium in Michigan. I have just rolled houses over there. That is my favorite area to work to.
Yep. So I mean, you know what I mean? It's there's opportunity everywhere. That's the beauty of it. I mean, like Medicare just kind of opens doors, to be honest, as far as getting back started. But again, like just so you guys know, I don't have a preference. Like if you want to do field or phone or whatever, that's fine. I'm just going to tell you what I know, and getting started in the field is more profitable, especially for new people. But if you've got some cash flow, there's nothing wrong with the phones. The phones works great for volume.
Is it when you can door knock Medicare without doing the scope of appointment, right? You can just show up and be like, "Hey, by the way, you filled out this piece of paperwork."
Med Sup, yes, but we've got a whole system for that on the Advantage side. We're not door knocking for Medicare. We're door knocking for what we're door knocking for.
I just because I know there are a lot of I know Jacob's whole team, they all door knock and
Great. So that's what that's what the majority of our squad does too. But again, we're not there. We don't use the M word.
the Medicare.
Yeah, we're here to make sure you get all the benefits you're entitled to. You fill this card out to get extra benefits.
Okay.
Do you want to go over what you qualify for? Here for whatever county y'all are in. I'm here for this county. You filled this out for extra benefits. And it's not bullshit. It's not final expense version. You're literally there to give them more shit.
It's all free.
Yeah, but you can't use that word either. It's just that it's no cost.
No cost. Okay, good to know.
No cost benefits, which is also bullshit, but it's true. So that's what you have to say. So, I mean, again, we'll go over, like, we've got the scripting all ironed out. We've got everything from recordings of door knocks, recordings of presentations. We've got all that stuff. But again, I just wanted to give you a higher level view of it today. Hopefully to get you a little bit excited about it. Because believe me, the first time somebody told me about Medicare 5.5 years ago, I didn't do my AHIP the first year. I was like, fuck that. I'm not taking a test. I got 40 final expense direct mail leads to work. I'm not like, fuck that. I'm gonna go write $8,000. I'm not fucking talking about $0 whatever bullshit. But 5 years later, I got told Mike, give me 100 Medicare producers over 3,000 life producers all day. Every single day and twice on Sunday. And I mean that completely. And we'll do another call on the building side of this, but I can show you why. It's not just my opinion. I can show you why it makes more sense to do it that way long term. Because look what happened to all these big life agencies. They either sold or they're in so much debt they can't sell. There's no in between. So these Medicare guys, they had something figured out when this stuff all started, but it works out good. So yeah, guys, I appreciate you guys being on, and Mike, thank you, man, for
No,
setting
thank you. Because like I'm getting bombarded with questions, and I'm like, all right, I've just got to do a call, cover the quick basics. We don't need to go in depth. That way, like this, I can give this to the five other guys on here. They have it. They can disperse it to their agents, and everybody can get the questions they need just by shutting up and listening to a video that's going to answer everything. And it's not going to be some dumbass dude talking on a stage or some stupid PowerPoint. It's just guys asking questions on the Zoom, finding out what they need to know. So.
Yeah, I appreciate it, man. Do you guys have any other questions that you guys think your guys might have or anything like that?
No, I'm good. Thank
No,
you
I
for
just
going over
kinda-
it.
Sure, brother.
I kind of just thinking how we can tie it into reverse mortgages, which are government-backed mortgages for older people that allow them to not have a mortgage payment. So
Are you literally
We'll
getting,
go over that.
or you're
That's kinda
really
where my
getting their
mind was.
mortgage?
Well,
Like,
here's the thing. Every single person over, and let me ask you this, I guess, and you would know better than me. Well, on average, about what is about? It doesn't give me a plus or minus 10%, whatever. Is the average age over 65, you'd say?
yep, for reverse mortgages, it's over anybody over 62.
Okay, so the age of Medicare is 65.
So definitely a lot of
But the
cool,
vast
cool
majority of
things we can think of there. Yeah.
Absolutely. Like you wouldn't need leads. I wouldn't tell you to buy leads. It would be very disingenuous. If you're talking to people like that already, that's easy. That's very, very, very easy. Hey, also, we do this. Hey, also, guess what?
I'm your best friend.
Not only do you not have to pay for your house, you don't have to pay for your Medicare.
Here's the address of your no-cost benefits. You get all this shit for no cost.
Yep, we can get creative with that. Well, I don't have a script for that because believe it or not, I don't even know what the fuck a reverse mortgage is, but it sounds cool. Wait till I get home, they offer it to me. I'll fucking sign up.
Bro, it's basically what they say they pay you back the equity in your home, and then when the mortgage is done and over with, you no longer have a home. It's basically like if you're broke, here's money, but at the end of it, you're not gonna have a house anymore.
Yeah, it's like you use the equity in your house to pay your mortgage payment until you die, and then whoever your house was being left to doesn't get your house anymore. The government gets it, but you live comfortably with no mortgage payment.
Yeah.
Those are both incorrect, but you guys got an idea.
Whatever. I'm
Bro,
good.
she's the mortgage guru over there.
I trust you guys, but I don't have to do it yet, so we're in good shape over here. But no, you definitely that could be a gold mine. You got that many old parts to talk
Wait,
about.
do you even own a home? Because you don't own a car. Do you own a home too, or no?
Yeah, a bunch, like 79 properties.
Holy shit. You need to refinance them? I'm your guy. I can do it.
All of them are owned either on land contract. I don't have any loans, either or for my business or from the land I own. Which not saying I never will, because it's definitely a lot of leverage, and we're going to once the right deal comes by. But the state of Ohio is great for old people that own a bunch of land and properties that don't have anybody that wants to take it from them. That's why
Bro, I
land-
do all my business in Ohio.
it's a great state.
Everything I do is in Ohio.
Awesome.
I love
Ohio's
Ohio.
Ohio's
I love it.
awesome. I do too. I'm just never there, but that's where all the properties are at. But
All right, and I was gonna say he loves Ryan Day too, so I'm about to get off this call.
come on, man, damn.
He got steamrolled 2 years in a row for a reason.
Listen,
Great.
it's a work in progress. He's the new John Cooper.
Right?
Dude,